Doc Discussions with Dr. Jason Edwards, brought to you by St. Luke's, St. Louis.
Welcome to Doc Discussions. I'm Jason Edwards, and this is the world's best medical podcast where we have discussions with physicians to discover who they are and what they do. I am honored today to be joined by Dr. Randall Dooley. Dr. Dooley is a urologist here at St. Luke's Hospital. Randall, welcome.
Glad to be here. Thanks for having me.
You bet. And so, I want to come right out of the gate. You're an interesting guy. You play guitar, you practice Krav Maga, and you are a urologist. Is there a common theme between these three disciplines?
Well, are the sensors available? I think that if you go into any sort of surgical specialty, there's a little bit of it takes a little bit of cojones, if you will. Sure. And so you're often a more baseline, have a higher threshold of excitation. Okay. So the combat sports, jumping off cliffs in the ocean, riding motorcycles, doing all these sorts of things. Yeah. Playing in a band. We're always looking for
the thrill, right?
The thrill. You only go around once. Yeah.
When being a urologist it's a difficult specialty to get into, and the surgical specialties and many other specialties are kind of a difficult go as far as your what the things you have to do on a day-to-day basis. All of playing the guitar, practicing martial arts, being a physician, all of these things it's a certainly delayed gratification. I mean, the first day on the guitar, you're not great. The first day at Krav Maga practice, it's not you get beat up. Sure. But they all kind of take this long-term discipline too.
Sure.
And do you enjoy that? Do you enjoy that process?
Well, it drives my wife a little nuts because I get obsessive about things that I get interested in. So I recently decided to teach myself to play chess. Okay. And so I play chess. Like I have 15 games going on simultaneously on my phone at any given time, and I'm in these international tournaments. I started in November or so of 2023 teaching myself to play chess. So I will get involved in something, and I will put a whole bunch of time into it, and to a point that other people might find a little obsessive. But I've always enjoyed, I'm fluent in Spanish. I've been teaching myself a little German. Yeah. I like to do things to expand the mind and to put challenges in front of myself that are difficult, just to see if I can do it, sort of thing.
So I've been down the chess pathway before, and it I think it's good for the mind, and it's also not scrolling on social media. Yeah, it's also not smoking cigarettes or drinking at the bar. It's a social thing too, or it can be. Can be. Obviously we have the national was it the World Chess Museum here? We have something here that's a big deal.
Central West End.
Yeah, and so the chess club, and boy, you can get. I use chess.com, which is that what you use?
I use chess.com, and there's another one called Chess Royale that I use. Yeah, and I play on a board too, so I do that too. Yeah. And I play against bots. I play against friends. I play against my family. Yeah. And I'm teaching my little guy who's almost 8.
Awesome.
And he's becoming a little obsessive about it.
Well, kids can be really good. I mean, really good. I've played some young children. I actually at our 2 or 3 weeks ago, I played one of our friends. They had an 8-year-old child, and I mean, I could beat him, but right. You had to pay attention to what you're doing, and so and I think that the child's mind can really develop that a lot faster than, me and you are probably a little past our prime as far as that kind of thinking. Well, but
it's interesting because I read a quote from a chess master, a grandmaster, and he said that being able to play chess well is the mark of a gentleman. Being a grand master in the chess is the mark of having wasted one's life.
There is a sweet spot here.
There definitely is.
Yeah. Yes. I think, doing things like this too, there's the element of mastery. You can get into a flow state with music, sports, certainly chess, where it's just kind of a nice place to be, mentally. And I would assume that, surgeries, that you've done many times and you're proficient at, you can kind of reach a flow state too. Do you ever feel any of that?
Oh, absolutely. My favorite time doing my job is when I'm in the operating room and I'm just in my zone.
Yeah.
Plus, you get to pick the music. That's part of the reason I go to surgery. You get to choose the music, which has always been I'm a little bit dictatorial about. Like, no, we're not listening. This is.
Well, the surgeon is the captain of the ship.
Exactly. So.
And then you have a favorite band. Who's your favorite band?
My favorite band of all time is The Cure, and I've seen them. I've traveled all over the world to see them play. I saw them play in a medieval fortress on an island on the Danube River. I've seen them play in Prague and Budapest, and I saw them play in outside Copenhagen in the Irish countryside. So lots of really interesting venues.
Yeah.
And leads to meeting people that are local, and then that leads to different experiences than the average traveler gets.
Yeah.
So, I've been a big world traveler seeking out and it all happened just kind of a crazy whim of a buddy of mine who was awake at 2:00 in the morning, couldn't sleep, was scrolling the internet, and he found this festival in the Irish countryside, and The Cure was headlining it.
That's awesome.
And he bought tickets on a whim, and he called me up and said, "Hey, we have to go to this."
So now,
I agree with you. We have to go.
The OR nurses get a healthy dose of The Cure.
That's right. Well, it's another form of benefiting their, expanding brains.
Yeah.
It's helping them.
And so what are some of the common surgeries that you do in your practice?
So I would say that the most common procedures that I do are related to stone disease or BPH.
Okay.
And then there's a fair bit of cancer surgery as well and that sort of thing.
And BPH is benign prostatic
hyperplasia, right?
Yeah.
So I do a ton of BPH-related surgery.
And can you explain, what's the 1 minute explanation of how that surgery takes place?
Well, so there are actually several different procedures, and the selection of which depends on what the end goal is and also what the patient's tolerance for different side effects of treatment are, because the procedures that have the best outcomes, the most durable outcomes as far as improving voiding symptoms, also come with some risk of potential sexual side effects and that sort of thing. Whereas if your real big priority is preservation of sexual function, then that may lead down a different.
Got you.
Different, because some are ablative or actually removing tissue, some are more manipulating tissue out of the way.
Okay.
Or there's a procedure I do where I inject steam into the tissue that causes a delayed breakdown and reabsorption of tissue. So there's everything from the old school TURP that's been around for 100 years to lasers and steam and implants.
Yeah, sometimes the old school stuff's still good,
works.
Right? Yeah. So, and just for I'm going to back up just a bit. Of course, you know this, but the urethra is a tube that comes from the bladder and then, for the man out through the penis, but it goes through the prostate, and if the prostate's larger, it can kind of crimp the urethra a little bit and make it difficult to urinate.
Right, so there's a static component and there's a dynamic component. So the static component is basically characterized by the fact that there's just tissue there that's just obstructive. So it's just mechanically causing obstruction. And the other component is the fact that the tissue is densely enriched with smooth muscle that maintains a tone.
Got you.
And that's involuntary. So it additionally, it's supposed to be part of your continence mechanism and your ejaculatory mechanism, but what happens when it overgrows is you become sort of hypercontinent, obstructed. Yeah. And so, we have meds to treat the dynamic component. We have meds to treat the static component.
Got you.
The procedures, you're sort of, if you're removing tissue, you're sort of eliminating both.
Yeah.
One of the things that's been unfortunate with the advent of some of the medications is that, there have come to light some fairly serious long-term consequences, side effects of the medications. For example, recently we have discovered a link between tamsulosin or Flomax, which is commonly used to treat the dynamic components, alpha blocker, with increased risk of dementia. There seems to be a link, and then with finasteride, there seems to be an increased risk of depression in the elderly.
Okay.
Use. So in addition, there's a litany of other potential side effects, but they also don't really prevent deterioration of bladder function over time. And what really does do that is procedures. And so the pendulum is swung a little bit towards earlier intervention versus waiting until they fail medical therapy and this sort of thing, which has been
and then you have organ dysfunction.
Right.
Yeah. How about that? And so what other and then you do prostatectomies where you remove prostates in patients who have prostate cancer, correct?
I don't personally do that much anymore because I've done hundreds of prostatectomies, but they're all open.
Okay.
So, but I've been able to successfully recruit a partner, and we're hoping to get another one as well. And the partner that I have recruited, who's going to be starting the first week of September, he's robotically trained, so he'll do robotic.
Okay. Yes.
Assisted laparoscopic prostatectomy.
I've met this physician, and he seems like
Barashi. He's a great guy.
Yeah.
Coming straight out of WashU.
Yeah. And he's Venezuelan, I believe.
He is. He's Venezuelan.
Yeah.
So it's interesting because I speak Spanish fluently, and he's from Venezuela. I train at Krav Maga, and he's Israeli. His parents live in Israel.
So we
sort of have these weird commonalities.
So this is a weird thing. So he was telling me that he was Israeli from Venezuela.
Yes.
And I know one person exactly who's Jewish and from Venezuela. I don't know her personally, but her name's Steffi Cohen, and she's a world champion powerlifter. Oh, interesting. And so I just said, hey, do you know Steffi Cohen? Yeah, I know her. He said, she was at my wedding. And so I thought, how crazy is that? But he seems like a great guy. And I also have another mutual friend with him who's a urologist, but I've only heard good things. And so I think
he was on the Venezuelan national water polo team.
Really?
So he traveled around the world competing.
How about
water
that?
Polo. Crazy.
I think the urology department's in the running for the most interesting department.
We try to be.
And then you have Dr. Naughton and Dr. Scully as partners as well.
Yes.
Correct. Yeah. Was there anything that inspired you initially to go into urology?
Actually, when I was in college, I had a good buddy, and we're still close friends, and his uncle is a now retired urologist.
Okay.
And we used to go to his house because he had this sweet pad in San Diego, where I'm from, and he always had this really great music collection, and he always had top shelf liquor that he would serve us, and he was grilling up steaks and everything, and he would hang out with us and listen to music and everything, and he was this really interesting, great guy. But I always was asking my buddy, like, what's wrong? Why did he go into urology? Like, what's wrong with him? And anyway, but I always really liked the guy. But when I went to med school, I said the last thing I would ever do is urology.
Okay.
But I was on general surgery as a third-year med student, and we had a mandatory specialty rotation, and I was scheduled to do plastics, which appealed to me because of the artistic sort of aspect.
Sure.
And so I was scheduled to do plastics, and the week before the scheduled rotation, I got a page, because we had pagers back then, from the secretary of the department who told me that the professor who was going to be overseeing my rotation was actually going to be on vacation for 2 of the 4 weeks, so they had to cancel the rotation. So I was scrambling for a specialty. So I talked to the chief resident. I was on trauma surgery at the time, and he said, "Oh, you should do urology." I said, "Urology? Why would I want to do that?" He said, "First of all, you need a rotation, and they'll take you.
Yeah.
Second of all, coming off of general surgery and rotating on urology, you will find is like night and day. Those guys are so much happier. They enjoy their job so much more. They do these big cancer cases, and then they do all these minimally invasive cases, and they can tailor the practice to however they want to practice. They don't seem to be all stressed out all the time. They have a very busy daytime schedule, and in the evenings they don't go in as much as the general surgeons or orthopods or other surgeons do. So it's a really great work-life balance. And so worst case scenario, you learn about an organ system that most other physicians don't know much about.
Yeah.
And so I rotated on it. And
the rest is history, right?
That's where it came from.
Yeah.
It really was night and day. I mean, you went in there and you're joking around and telling dirty jokes. And
I had to do a year of general surgery, and I did a month of urology, and I actually found it enjoyable. I mean, it's a nice niche where there's not a lot. I mean, I'm sure in some areas people are encroaching on it, but it was like, like we got called from the gynocs, And they would have us, put in ureteral stents and things like that because you have a cervical cancer that's, pinching off the kidneys. And it's kind of surprising, kind of how many areas of the hospital that the urologists were involved with.
Right. So, we're always getting called in by other surgeons to help them.
Help them. Yeah.
Yes.
Yeah. Somebody accidentally nicks the ureter, and then all of a sudden you're involved.
Or sometimes they just have a patient on the table, they can't get a catheter in.
Yeah.
I mean, or it's or the inadvertent bladder or
that was
ureteral injuries.
The funny thing. So that was like my job when I was like the radonc intern who was doing a month in urology, and they would be like, we can't get a catheter in. And, Buck, who was my chief, would say, Jason, get a coude and, put some gel down there and just shove it in, and I was like, I'm going to the ICU, and there's like, this is not at this hospital, but I would go to the ICU. There's like a nurse who's put in like 1,000 catheters, and I've put in 3, and like, I'm tasked with like getting the job done.
Right.
But in surgery, you do have this kind of gung-ho mindset of like, come hell or high water, I'm going to get the job done. And so I think I got them all in, but it was an enjoyable month, and they were all really funny guys, and I don't know what it is, but most urologists are fun guys to talk to, and they have a good sense of humor, and there's kind of a good atmosphere there.
You sort of have to do the job. It's a requirement.
Comes with the territory.
But it's funny what they say about surgeons is that they're usually right, but never in doubt.
Well,
that's how you have to be.
Randall.
No one wants a wishy-washy surgeon, right?
Yeah, that's right. You need to be decisive, right, in the operating room. There's not much room for kind of futzing around. Right. Yeah. Well, Randall, yes. I appreciate you joining us here on the podcast. I'm glad to work with you here, and I'm happy that you and your team are here at St. Luke's taking care of our mutual patients.
We're glad to be here, and we're just keep expanding, so can they get a full complement of us. So
yeah, very good.
Because Tom will retire one of these days, and we need to
keep growing,
keep it going. So
yeah. All right. Well, thanks so much.
Well, thanks for having me.
Thank you for joining us for this episode of Doc Discussions with Dr. Jason Edwards. Be sure to check out our other episodes and tell your friends.